right, I think we can go ahead and get started since I know it might be late where some of you are. So welcome. My name is Megan. I'm the Associate Director for Student Support and Programming within the Office of Global Services. And we have with us today our last of the pre-arrival webinar series, Thrive, Navigating Health and Wellness at Northeastern. I'm joined by three of my wonderful colleagues, Dr. Dalal, MD, a Medical Director of UHCS, Allie McNamee, New Ship Communications Manager. And if you're not familiar with those acronyms, you will be very soon. And Asher Mumtaz, who's a wellness specialist. So if you have questions as we go along, please type them in to the questions box in GoToWebinar, and we'll try and answer them as we go through. And otherwise, I'll pass it over to my colleagues, and thank you again for joining us.
Great, thanks so much. I'm so excited to be here to speak with all of you today. We'll go to the next slide. So we know that being away from home can be hard, and we just want everyone to know that we're here for you, and we want to talk about some of the health and wellness resources that are here, and just be able to ensure that we can provide the support that you need, and that support is always available. But we know that being prepared and just being knowledgeable about some of the resources that are available will help as you enter this new journey. So just some real general tips for health. Sometimes, we know all these things that our parents and our doctors have shared with us throughout our lifetimes, but when we get to a new environment, things can be a little bit different, and we may forget some of the general health things we want everyone to remember. So we know that small, consistent habits will support your well-being through your entire journey. So really thinking about making sure you're eating those nourishing foods that you probably grew up with. So a lot of those fruits and vegetables and whole grains can ensure that you're going to feel well throughout the time that you are studying. It'll keep you alert and ensure that you are getting the nutrients that you need, all those vitamins and minerals. We do see some people coming in with different medical conditions, and so ensuring you're having a balanced diet will definitely make a difference. Staying physically active is really important. And so no matter what that is, that could be getting up in the morning and taking a walk. It could be actually going to the gym and getting exercise, or it could be being involved in any type of sports activities that you like becomes really, really important. Again, to keep your body fit and healthy and ready to study and work as you need to. And we know that being physically active in general keeps us from having those chronic conditions over time. But it can also be really simple things, like if you like to go dancing, or being able to dance or just move in different ways can make a big difference to how your body is. And then we like to talk about sleep a lot. So sleep can be challenging, especially when you're staying up late at night and needing to do all that work. And so really thinking about how can we set those sleep habits so that you're feeling awake and alert in the morning. And so trying to ensure that you're getting a good amount of sleep at night. And some of that is doing simple things like waking up in the morning and exposing yourself to light so that you are able to activate your brains, and then getting to sleep at night when things are dark so that you're able to sleep well. Thinking about your caffeine intake might be important. So a lot of people do drink a little bit more caffeine, so tea, coffee, etc., which is okay to do, but just being cautious that that sometimes can affect sleep habits. So again, thinking about that becomes important. And of course, you're going to meet lots of new people here, which we're very, very excited about. We want you to build lots of great social connections, which is good for your overall health. So definitely thinking about how you're going to be doing that. Sometimes people do that by making new friends, having new mentors. They might decide to volunteer. They might decide to go see new places where they'll build lots of social connections. But that becomes a really, really important piece of your journey through Northeastern. And then, of course, you're going to be managing stress. So we always sometimes will think about stress as not being great, but stress can also be really good because it encourages you to do things that maybe are out of your comfort zone. And so it's totally normal for you to have stress during those times. But sometimes that stress can get a little bit overwhelming. Where you're not able to do all the regular things that you were able to do. And so we're going to be sharing some mental health supports in those instances. But we encourage you to really talk about stress so that we can deal with it rather than kind of making it, making it take over our bodies in different ways. And then lastly, we like to talk about avoiding risky substances. Sometimes it's normal to try to experiment with some things like alcohol, marijuana, nicotine, but those can be very harmful. It can affect sleep habits, it can affect your mental health. So we want to be really cautious about that and know that there are resources available within the system to help you with that, particularly when that becomes to a level that's affecting your performance in general.
I just also wanted to add that as an international student, even if marijuana is legal in the state that you are in, it is still not legal for you to do, because as an international student, you need to follow federal laws and not state laws.
Thank you. And just some general tips to prevent infections, because unfortunately, viruses, bacteria are everywhere, and that's normal. But really simple things like washing your hands often. Some people will use hand sanitizer, but using just plain old soap and water, especially before eating, can be helpful. And especially if you're traveling, because you may be here for bits of time, you may be going to different areas in the US also. Some people also return and travel internationally to different new locations, and being mindful of that becomes important. In the winter months, we do see an uptick of general viruses, regular colds and things. So just being able to cover coughs and sneezes can be helpful in keeping others healthy also. So sometimes having access to those masks can be good for yourself. And then of course, washing hands with that and using that sanitizer. And just being careful about sharing drinks or utensils and cutlery, because that can transmit some diseases. And so just be cautious with that. Then of course, we recommend you get vaccinated, and we will talk about that over and over again, because that becomes a very, very important way to prevent some diseases. So in order to plan for your travel to here, we do encourage you to maximize your health before you get here. So that can be ensuring that you have a complete physical exam with your general doctor is really great. For some reason, if you're not able to, we can provide resources for you to connect with what we call here primary care doctors, who are like general doctors in different countries. And that will be able to get you set up with someone here who you can see year after year, and also when you have any illnesses that you need to have addressed. And for those who are on chronic medications, these primary care doctors can also help meet those needs to ensure you're getting the medications when you need to. Both that primary care doctor and others can provide those required and recommended immunizations. But again, if you can get those before you get here, you're going to have one leg up in ensuring you stay healthy during this time. And then lastly, just thinking about things like dental visits and vision visits, ensuring that if you have contacts, glasses, for vision, you bring those with you, of course, and then have those vision visits already set up before you come is good. And then also for any dental visits, so a lot of people will have issues with cavities or other teeth problems. And if they can take care of that before they come, it becomes a little bit easier, because there can be some cost associated with any of these medical, dental, and vision visits, which we'll talk about a little bit. But it's perfectly it's actually best practice if you can get those issues addressed prior to coming. Great. Again, if you can consult with your current healthcare provider and review any anticipated healthcare needs, including any prescriptions you might need. Prescriptions internationally and here sometimes can be different. We do have individuals go to a pharmacy to pick up any medications which require a prescription, but that has to be prescribed by a medical provider ahead of time. Also, the names of medications can be different from where you are at. So sometimes finding the right medicine to meet your needs takes a little bit of time. So again, trying to get set up with a provider here and ensuring that your provider where you currently are is able to direct you in terms of what you might need will be really helpful. And then having a copy of your medical history, any current medications, including prescription and over-the-counter medications, any current allergies that you have, particularly to medications. So we want to make sure we avoid prescribing those for you. And then having access to any other pertinent medical information that can include things like surgeries, past hospitalizations will be really helpful as you access and try to determine what your healthcare journey might be here. And so really thinking about packing for that healthy trip, it would be great if you do have current medications you take and other over-the-counter medications to bring those along if you can. Some medications may require information from your doctor to be carried with you, but any over-the-counter medications that you might need, for example, for pain or fever, some people will use what we call here acetaminophen. In some countries, it's called paracetamol. You may use here ibuprofen, which are all fever and pain reducers. So having those either on hand or getting those when you come here is certainly some things you can do. Other allergy medications you might need are good to carry along. Some people have EpiPens because they have severe allergies, and so they may need to carry some medications with them here. And ensuring that those are packaged in a way where they, because some medications do require refrigeration, you just want to talk to your doctor and ensure that they're packaged properly, or that you're able to access them once you get here. Having a first aid kit is always good to have. So things like Band-Aids, gauze, electrolyte powders, if you have, for example, diarrhea or other illnesses or dehydration for some reason, these are good things to include within your own first aid kit. And then other medical supplies. This can include things like earplugs if you go swimming. It can include those glasses or contacts. Inhalers for asthma, and include spacers, which some people will use with their asthma devices, retainers if you do have had any orthodontic work in the past. So these are all good things to carry with you, of course, within any type of medical kit. And then any supplies to prevent illness. So obviously in the summer, it can get very hot, so sunscreen may be helpful. And then of course, things like insect repellents are good to carry. Great. We'll just talk a little bit about some of Northeastern's requirements in terms of immunizations and TB screening. So as far as immunizations, there's a list of required vaccines. We know that the incidence of vaccine preventable diseases like measles and pertussis is on the rise. And so we encourage you to be fully vaccinated against these specific diseases before you come. So you can see the list of required vaccines and the strongly recommended vaccines. You should have received information about submitting this information. Next slide. Requirements are due 1 month prior to arrival on campus. And to submit this information, you want to click the Century MD required immunizations link in the Student Hub under Health and Wellness, but you should have also received an email regarding this. Again, we encourage you to submit this at least a month prior to arrival. And then for some reason, if you're not meeting all the requirements, you will get information back about how to go about doing that prior to getting onto your appropriate campuses. And then there's also a tuberculosis screening form. This is one that we sometimes do get questions about, but there's 4 boxes that are on this form. You do need to check at least one of the 4 boxes. And in the first box, there is mention of checking it off if you are born in certain countries. Most people who are coming internationally will actually have been born in those other countries. And so you would want to check off that particular box. And then just read through it and ensure that your entries are accurate. You want to make sure you sign the form and make sure you date the form. Without those specific boxes checked, or the signatures on that form, or adding that date, that form will be rejected, and there may be a challenge in meeting the requirements for Northeastern.
Okay. Oh, sorry. Thank you, Michelle. I'm going to take a couple slides here and just talk a little bit here. So as we discussed at the beginning, I work with the student health plan as well. So please remember my name. Feel free to reach out if you have any questions about health insurance or anything anything health insurance related I can help you with, or at least direct you in the right place. So in terms of once you get here, in, you're going to want to assess how to navigate your care. First, and we'll talk about this on the next slide, we'll go through what your care options are in the United States. They may be different than you are used to in your home country. Now, your medical information is something you're going to want to have on you, and you're all going to be eligible for the health plan. And you'll all see that fee on your bill, and your coverage will begin September 1st. On September 1st, I'm going to send out an email from the Student Health Plan website to let everyone know that how to access their insurance information. It's going to be on your Student Hub. And that's how you'll be able to find your subscriber ID number, learn how to get an insurance card, etc. There'll be a lot of information in that email. There's just an overview welcome packet, but I do recommend keep an eye out on September 1st for that information so that you can be prepared going forward. Now, with your insurance, obviously, you can use it to get medications and lab work done. And one thing that you will want to keep in mind with most things regarding healthcare in the United States, which may be unfamiliar, is that there is typically going to be an additional cost involved. The insurance will cover most of an appointment, and you will still have a small cost associated. So always be prepared to receive a bill in the mail for your portion of the cost sharing. We'll go over health insurance basics in a minute, and then also specialized and preventative care. So if we can go to the next slide, that'd be great. Okay, so knowing where to go when you need healthcare is very important. It's important so that you get care, the right care you need. It's important so that you don't have to wait a long time for that care. And it's also important financially because certain kinds of care are more expensive than others on your end. So Michelle talked a lot about the primary care physicians. You're going to want, and you may be familiar with them as family doctors or general practitioners. They would just be your general doctor. That's something you're going to want to form a relationship with a primary care provider in the area of your campus so that you can have someone monitoring and keeping up with your health over a year-to-year basis. Under the student health plan, which you will be enrolled in, you do have a annual visit, physical to the doctor that is completely cost-free for you, so there's no copay or anything. So that's a good thing that you want to take advantage of. And in order to do so, you definitely want to find a primary care on the sooner side to make sure if there's a waiting time, you are prepared for that. And then try to make that part of your routine. Go once a year for your general checkup. Now, in times when you may have some sort of non-threatening, non-life-threatening issue, but something that you need to be seen pretty immediately, then these are where urgent cares are going to be a very good resource. To go to an urgent care, the copay for you is $25, and the rest of the appointment will be covered by the insurance. And you can walk in without an appointment, although at many you can make appointments, so it is worth checking in if you want to do so to save yourself the waiting time. This is where you can go for non-life threatening but urgent needs. If you think you may have an illness you need checked, if you have some sort of skin rash, some sort of pain, that's where you want to go. Now, the emergency department or emergency room, those are interchangeable terms. These are where you would want to go if you are having either a life-threatening condition or if it's at a time when urgent care that you can't find an urgent care that's open, as they do sometimes structure around business hours. Emergency departments are open 24 hours a day, and they're where you go in terms of an emergency. Now, the reason I'm pushing so much the importance of knowing the difference between like an urgent care visit and an emergency department visit is because at the emergency department, you can expect a higher cost for you. It's going to be $50 copay to go in, and then it will be 10%. You'll have to pay 10% of the bill. It doesn't add up to so much, but definitely more than the $25 at urgent care. And if you are not there with a true like life-threatening condition, you may be or you should expect that you're likely going to have to wait a while in the emergency room. But with that said, it's important to know when you do need to go to the emergency room. And those are times when you are facing shortness of breath, any sort of having trouble breathing, any sort of allergic reaction, because those can turn serious very quickly. You want to be in the emergency room during that. Broken limbs or limbs that appear to be broken, um, severe burns, any loss of consciousness. These are times when it's a good idea to consider the emergency department. If it is extremely serious, you need to get there immediately and you need life-saving care on the way to the hospital, that is when you may want to call 911 for an ambulance. The cost for taking an ambulance is $100. And then when you get to the emergency room, you have the additional costs. I'm putting that out there so you know this is what it's going to cost you. So you want to only use this sparingly if it's really necessary. It is not the best way to get to the hospital unless you are in a life-threatening situation. And if you are, then the benefits of an emergency room is that, of the ambulance is that you can receive life-saving care on the way to the emergency room. There are emergency medical technicians uh, on the ambulance who will be able to help provide that care. Now, specialty care is considered to be anything that's not an urgent need and above primary care, essentially. So it would be more about what a specific specialization. So dermatology, physical therapy, um, anything along those lines, cardiology, any specific doctor that focuses on one specific area or treatment, that's going to be a specialist. These are great usage to you, and you have the freedom under the student health plan to go to see one. Under many health plans, you would need to get a referral, which means basically your primary care provider would need to recommend that you go to a certain provider, and that would be the only way you'd be able to make the appointment. Under the student health plan, you do have the freedom to reach out to specialty care providers on your own and determine if you need to see them and go and see them without a referral. So that's a huge benefit with the student health plan that you'll have. And the next slide, please. Okay, so we also have touched a bit about this, but it's always important. The first question that you're almost always asked when you sit down with a doctor is about your personal medical history. So before you go to an appointment, it is good to review that with yourself. What medications are you on or have you been on? Have you had any surgeries? What have you been diagnosed with? Do you have allergies? Um, Refresh your memory on what you may know about your own family history. Do you have a history of high cholesterol or cancer? It's good to understand that. If you have specific cultural preferences, this is a good time to bring that up with the provider. And this just allows them to keep your health record up to date and provide you the most accurate care for you. So this is really a big benefit for you without you having to put that much work into it. Just prepare a little bit before the appointments, make sure that you are able to provide the doctor with the best information about you so that they are able to assist you the best they are able to. Next slide. So we touched upon this a bit as well. So for medications and lab work, prescription medications, you need to have them written or approved by a provider. So you'll need to see a provider and they will have to write you what's called a script or a prescription, and they will send it to a pharmacy and you can go and pick it up. Those will be run through your insurance and you'll pay a small percentage of the cost of a small copay for the cost of the prescription drug. These are ordered by a doctor. It says their OTC meds are freely available. That stands for over the counter, which is the term that we use for medications that do not require any specific provider approval. You don't need to see a doctor in order to buy them. I'm talking about allergy medications, most painkillers that we were talking about before, such as acetaminophen or paracetamol, ibuprofen. These are all medications that you can pick up off a shelf at a pharmacy and walk up to a counter yourself and purchase them. It also means over-the-counter medications. Those do not go through your insurance. So just so you're aware, those are not related to insurance at all. You would just pick them up on your own. Pharmacies do require your ID and insurance for picking up most drugs, definitely your insurance and your ID for most. So make sure when you're going to the pharmacy that you are prepared to actually give them what they need so that you can walk away with the prescriptions you are hoping to get. So your ID and your insurance card, you always want to have those on you. And then lab work can be ordered by a provider to diagnose a new condition, monitor an existing condition, and that would be they will order similar to a prescription. They would order the lab work, then they would basically write you a script. You go to the lab and they do the work as prescribed, and have the doctor will then interpret the results and deliver the news to you to let you know what these results mean, so that you don't need to figure out what all the numbers mean of the actual result. All right, next slide. Okay, so now a little bit more specific to the Northeastern University Student Health Plan, which is a mouthful of a name. So we do shorten that and call it NewShip. So you will be familiar with that acronym. At the bottom of this slide, you can see a QR code. That is to our website, and I strongly recommend that you take a moment to scan that. Our website has plenty of information. I'm going to touch on some of it in this presentation, but it has plenty more there, and is a good idea for you to read through. Specifically, there is a page on our website under the benefits tab that is titled the American Healthcare System. That will recap some of what we've already gone over, but it does talk and has it in writing of how to use your insurance to make an appointment, where you need to go to when you need healthcare, and where you would want to what costs you should anticipate. That is all written down on that page, the American Healthcare System, to help you navigate it. So I do strongly recommend everyone read through that at least once, just to kind of get your feet under you and understand the basics. Now, what do we cover? NewShip offers excellent, comprehensive global coverage. So it's a high quality, like platinum level, which basically means it's the highest rating of health insurance, that has very low out-of-pocket costs. So I've mentioned a couple of times the words copay. That would be the fixed amount you would pay for a certain service. Our plan is rated as being the most favorable to you, the member, in terms of how much of these costs you bear. Most insurances, you would have a larger percentage and you would be paying more, what we call out of pocket, which just means your own money for care you receive. So rest assured, this policy does cover you on a, comparably to other health plans. It's an excellent health insurance, and you're getting basically the best bang for your buck there. It provides comprehensive health care coverage everywhere. So that is not common for most health plans, but this means that you are able to utilize your health insurance anywhere in the world. This opens you up to go and take co-ops in other states, in other countries, to just travel, all that. Just know that you are always going to be eligible for this health insurance, and you will be fully covered when you're abroad or at home or at school or in a different state. Really, wherever you are, we've got you covered. Another huge benefit here is that you will be automatically enrolled. So you don't actually have to do anything in order to be enrolled. All eligible students are automatically enrolled, and all international students are in full-time programs and are automatically enrolled. So you won't need to do anything except for open the email I send you on September 1st. that contains information on how to access your health insurance. So some new ship basic benefits that we have here. So as I touched upon, there's nationwide and international coverage, which is a huge benefit. You have the enrollment in basic dental savings program. So I want to define what that means in the United States. And this is a little odd, but there are 3 separate industries. There's medical insurance, there's dental insurance, there's vision insurance. So we are discussing and we offer and enroll you in a medical plan, which means that there's not a dental plan or a vision plan. However, we do want to make sure that there are some benefits because things do come up. So you have enrollment in something called Basics Dental Savings Program included in your enrollment in NewShip, and that allows you to it's a network of providers who accept steeply discounted rates for services. So they operate in most states in the country, and you would be able to find a provider, search the exact service, and they'll tell you exactly how much that will cost with the discounted price, and you can utilize that. So that's a huge benefit. Also, for those on the Boston campus, we do have 2 partners that we are working with. There's Fenway Health and there's ADA Forsyth, both of which you have the option to get 2 preventative teeth cleanings a year, including x-rays. So between those 2 benefits, it's a pretty much patchwork way of making sure that any dental needs should be taken care of. Of course, if you are interested in getting an official dental insurance plan, that is absolutely your prerogative and you're free to do so. Just understand that NewShip can't advise you on that and we cannot recommend any plans and we do not offer one. So that would be something you would be purchasing for yourself that is unrelated to the school if you determine that these benefits don't meet the needs you're looking for, which for 99% of cases, this is the amount of dental care you will need. So you also have access to medical professionals 24/7 through the 24/7 nurse line. So this is great because this is completely free. So this is a very good way to find out where you need to access care. You can contact the nurse line and say, these are my symptoms. Do you think I need to go see a doctor right now? Is this an emergency? And they'll be able to guide you through it and give you medical information alongside that, which is a extremely helpful benefit. And you can call them as often as you want just to check in on any concerns you may have from the comfort of your own home. If you do have dependents, if you have children, if you have a spouse, we do allow the enrollment of dependents. In order to do so, you'll just reach out to us directly and we'll give you the instructions. There's a form on our website. You just fill that out and we add the dependent. It is an additional charge. And we discuss that when you reach out. And then, as I said before as well, I strongly recommend the American Healthcare System webpage on our website is extremely useful. I strongly recommend reviewing that and maybe bookmarking it, just knowing where you can find that information so that, if you ever have some sort of incident where you do need to access care, you are aware of where you need to search for this information and where you can find it, what the next steps are. So these are some of the services covered under NewShip. So we have access to primary, urgent, emergency, and specialty care, as we mentioned. You have full benefits for mental and behavioral health. So, that's therapies, psychotherapy, psychiatry, any of that. You do have full coverage for that. Sexual and reproductive health, you can also utilize UHCS for much of that, but that is fully covered. Now you have access to an app called the My Blue app. This is the application for your insurance. And it actually not only can it be a place where you track your medical care, track the claims that you've submitted, but also it will function as a virtual insurance card. which is extremely useful if you happen to be on the go or you have an incident and you didn't happen to have your insurance card on you. This is a way to make sure your insurance card is there. We discussed basics dental savings program, but more information about that is on the website, and I'm happy to answer any questions about that as well. But enrollment in that does allow you to access dental care when it's necessary. Have nationwide and international coverage. You can enroll those dependents. We do include gender affirming care, so that is completely covered. So no hesitation there. We offer discounted rates at Fenway Health for prescription costs for those dental 2 dental visits a year, and for just regular appointments, there'll be a slightly discounted rate, and you have access to that 24/7 nurse line. So with NewShip being a PPO, to reiterate, and that's the kind of plan that it is, that means that you can access all in-network care without any referrals, and you'll have extremely low out-of-pocket costs. I think that's the end of me.
Hello, everyone. My name is Ashim Mumtaz. I'm one of the 4 wellness program specialists here at Northeastern University. First of all, I would like to welcome you all at Northeastern. So I'm going to be talking about the wellness resources that you have here. So starting from that, so each Northeastern campus has a dedicated wellness program specialist who is here to support your overall well-being throughout your time as a student. We can help you navigate health and wellness resources, connect you with appropriate services, and provide one-on-one wellness consultations to provide you resources with stress management, mental health, healthy habits, and adjusting to student life. So we do provide resources around all of that and much more. We also closely work with OPEN, which stands for Office of Prevention and Education at Northeastern. OPEN provides education, workshops, and support related to sexual health education, alcohol and other substance use, healthy relationships, consent, and violence prevention. Their goal is to create a safe and healthy and inclusive campus community by equipping you with knowledge and connecting you with the right resources whenever needed. Throughout the year, you will see a lot of wellness workshop. You will see a lot of op open workshops. So please don't be a stranger. Feel free to stop by anytime, and we will be there to help you, provide you right resources. Just ask us anything you would need. If you can go to the next slide, please. So we are going to be talking about briefly some of the resources that we do provide here. So Northeastern, all the global campuses, we have amazing resources that you can use throughout your student journey. I'll start with one of the very few ones that is one of the very first ones, that is 24/7 urgent mental health support through UWIL. UWIL is an amazing resource that we do provide here free of cost to all the full-time students. You can log in using your Northeastern credentials, and you can get urgent mental health support, unlimited free counseling sessions, and you don't have to pay for anything. It's all free for you. Other than that, we do have a peer-to-peer support platform that we call Together All, which we will be talking more in the next slide as well. And apart from that, we do have Headspace app. Headspace is one of the very few apps that you can download for free for your mental health and well-being. Headspace will let you log in through your, if you can go to the next slide, I'm sorry. And one previous one. The previous one. Okay. So Headspace is one of the apps that you can download on your phone, and Headspace will let you log in with your Northeastern credentials for free. You don't need to pay for anything. You can use that, and Headspace is amazing to provide mindfulness practices, and also it can help you guide like meditation, sleeping tips, and all of those resources. And if you can go back to the Together All slide, please. Perfect. Thank you so much. So what is Together All? You might be wondering. So Together All is a peer-to-peer mental health support community, which is available online 24/7 and is completely anonymous. So you can express yourself freely and openly. Available 24/7. Student can set up Together All accounts, get support today. So you don't need to wait for it. You can just go in there, log in with your Northeastern credentials and ID. There will be a lot of students throughout who might be going through something that you might be going, who might be looking for support that you're looking to support, the same topics. And it's completely anonymous. You don't need to be worried about your identity being revealed. And it is also moderated by the community members and also the licensed practitioners who do make sure that everything is going in order. And we can move to the next slide, please. So supporting student mental health, and we do know there's a lot of information out here and you're just trying to absorb all the information at the moment, but if you miss any of the mental health resources and you don't know what to do, so these are our guidelines that we have created, not just for you, but also for the parents and family. So students can all of you can scan the QR code. You can get the two guides. One is for you that you have to read. If you find any resources, if you find anything in there that might be helpful for you. And if you don't, just please ask us and we are here to help. The second guide would be parent and family guide. That guide will help your family or your parents or your close, like any family that you have, and they would be able to like see what resources we have here and how we can support you and how they can support you by just going through the guide and just knowing what resources would be right for you. And next slide, please. So how you can reach out to us. So we are wellness program specialists. We are for different campus, there's different wellness program specialists, but you don't need to worry for that at the moment. There is a QR code. You can just scan that QR code. You can book an appointment with us. It's a global booking link. So once you book the appointment, a wellness program specialist will be assigned to you. You can have a one-on-one consultation with us. Just to know that your wellness program specialist consultation with you is not confidential. In order for us to help you, we will be connecting your information with other resources if necessary. Other than that, if you will have any questions, feel free to ask. Thank you.
Great, thank you so much. Those were a great review of all the resources. I just wanted to point out some information that you can obtain online. There's a lot of great questions coming up, and I'm sure there'll be more questions that'll arise about how to access these health and wellness services. So if you do go on to the Health and Wellness Hub, you can see it on this where it says above the wellness services location. If you go onto that hub, you'll be able to access all these resources and be able to scroll through by campus location, which will be helpful. In that health and wellness hub, there's also a specific tab for medical services. So you can go on there and search by campus, and that will provide information that you will need regarding the medical services also. Next slide. Many of the students will be on the Boston campus, so I just wanted to briefly talk about the University Health and Counseling Services. So there is an on-site health center in Boston that students will have access to, and we do provide same-day and scheduled care for most things. There are some illnesses, for example, type 1 diabetes, rheumatoid arthritis, which may require a specialty referral, and we can assist with navigating the healthcare system in order to ensure that you're able to be connected with that specialist as needed. We can also provide other network information. And on the other campuses, the wellness program specialist can help connect you with different providers as needed. On the Boston campus, there's actually a nursing triage that's also available on site. And as Allie had shared earlier, the New Ship line itself has a nurse triage that can generally refer you and able to provide information regarding any specific questions that you might have, and also can refer you to specific specialists as needed. But on the Boston campus, there are nurses you can speak to on the phone, and they can direct you to services as needed. In addition, on site, there are services such as a dietitian who you can access. There's point of care testing for which you would need a specific referral and be able to get things like COVID testing, flu testing when needed. There's also an on-site lab, but if you do need, for example, labs that are ordered by your own provider in another country, you would actually have to get a lab order from a provider here within the US in order to access that lab. And then we also do provide some vaccines, and many of them we do through an outside vendor, and you will be able to receive information about how to schedule those vaccine clinics once you get on site. And then generally, again, for UHCS services, we provide a pretty good number of services in terms of everyday care, any care for urgent concerns such as colds. Now, some of those types of illnesses that you may have, we can provide advice over the phone through our nurses, but some of them, of course, you'll need to come in for. And so there are trained medical providers. There are physicians and nurse practitioners and physicians assistants and nurses who are available to assist with medical concerns that are on the Boston site. And then there are additional mental health providers who are also available. There are drop-in hours for which you can see someone. They can also assist you by calling and speaking to you directly. And as Asher had discussed, there is the FIND program, which allows students to access counseling services 24/7 virtually. We also provide reproductive and sexual health services, some chronic condition management as discussed, and again, those vaccines and labs. Next slide. And these are just the hours specifically on the Boston campus. So open 6 days. We're actually open 5 days a week. Sorry, there's an error there. We're open Monday, Wednesday, and Friday, 8 a.m. to 5 p.m. and Tuesdays and Thursdays, 8 a.m. to 8 p.m. These visits are by appointment only. So we do ask that you call prior to arriving into the health center. And then there also are mental health drop-in hours as listed. So again, we fully anticipate that you'll have questions after this, so feel free to message the specific wellness program specialist through that global link that Asher shared, or if you're on the Boston site or have general questions, feel free to also email the UHCS site, which is uhcs@northeastern.edu. You can also access other resources through the Northeastern webpage that's previously listed. Sorry, Megan, could you go back to that previous slide? The phone number there, you can call to make appointments, and the location is on Forsyth Street to the University Health and Counseling Services Center. And we also encourage you to join the Instagram webpage there or add that so that you can access any types of messaging that we're sending out to everyone. Next slide. For insurance questions, for any questions regarding the Northeastern Student Health Plan, and to speak with Allie specifically or anyone within that plan, you can email newship@northeastern.edu or call that specific number. You can also at times meet with them directly. So again, you can email them to get more information on that.